Well, hey guys, welcome back. If you're new here, I'm Dr. Dray. I'm a board certified dermatologist. In this video, we're going to be talking about something that comes up a lot: unexpected bruises, large purplish patches, and little red dots that appear on the skin. Some people may say to themselves, did I bump myself? But sometimes your skin is trying to tell you something much deeper that's actually going on inside your body. So in today's video, we're going to break down what these different types of discoloration look like, these sort of bruises, whether it be petechiae, purpura, prominent bruising, and what they might mean when they're normal and when they're a red flag. Let's talk about skin bleeding. What is skin bleeding? When we talk about skin bleeding, we're not talking about blood that you can just wipe away off the surface of the skin. We mean blood that has leaked out from the blood vessels into the surrounding skin beneath the skin surface. This can show up to your eye as something called petechiae, little tiny pinpoint red or purple dots, or larger purple patches known as purpura. Ecchymosis, which is what most people refer to as a bruise. Think of your body's blood vessels like pipes. If the pipe becomes fragile or there's too much pressure inside of it, even the smallest little bump or no bump at all can cause leakage. And that leakage is what you're actually seeing with your eyes. Not all bruises are worrisome. Sometimes they are par for the course if you bump into something. Let's start with what's normal. Normal bruises appear after an injury. They can be tender and they change color over time. They go from red to purple to greenish yellow, and then they fade. Here are some red flags though that you should never ignore. Bruises that you have no memory of ever having had any trauma prior to the bruise that you noticed. Bruises that appear in unusual areas, like your back, for example, or your abdomen. Bruises that are large in terms of the surface area that they cover, are happening frequently and seem to appear suddenly. Also, don't ignore bruising that is accompanied by symptoms of fatigue, fever, bleeding gums, nosebleeds. If this is happening, it's definitely time to dig deeper. Petechiae. What are they? Petechiae are tiny red to purple pinpoint dots. Importantly, they do not blanch, meaning if you press on them, they do not fade. This is in contrast to redness that appears as a result of blood inside vessels. It will blanch when you press on it because you're compressing that vessel. In clinic, we can test this by taking a glass slide and pressing it on the skin to blanch. You can see right through the glass slide if it has blanched or not. It's very easy. There are many benign, not dangerous conditions that can lead to petechiae. Heavy coughing or vomiting can lead to an eruption of them on the face, the upper chest. Intense weightlifting, tight clothing, friction. Speaking of friction, you can often notice them after a bout of very itchy skin where you have been scratching, maybe a little bit too enthusiastically. The petechiae will then be grouped in a linear configuration in accordance with your scratch marks. Tight clothing is another potential friction on the skin. However, petechiae, they can signal something more serious going on internally, like low platelet counts, viral infections, reactions to medications, underlying autoimmune diseases, and blood clotting disorders. So if you see petechiae appearing out of nowhere and seeming to spread quite quickly, especially if accompanied by symptoms of fatigue, fever, or bleeding from the nose or gums, you're just feeling unwell overall, please get checked out by your healthcare provider. Let's talk about purpura. This is when the spots appear a lot bigger. Essentially, purpura is larger patches of bleeding under the skin. One of the most common types of purpura is not dangerous, and it is unfortunately referred to often as senile purpura. I don't like that name. Or more appropriately, solar purpura. This type of purpura happens because the skin has become thin with age and with cumulative sun exposure, and the blood vessels underlying the skin have become more fragile, more prone to leaking out blood, even with minor pressure or trauma. This is medically harmless, but honestly can be very frustrating to cope with and cosmetically bothersome. Check out my video on how to thicken the skin. I give some tips there on how to target and potentially reverse skin thinning on the backs of the hands. Another non-dangerous, non-harmful type of purpura is referred to as, well, benign pigmented purpura. Here you get these little cayenne pepper appearing spots, usually on the lower legs. This condition is simply the result of the blood vessels in the lower leg, which are under a lot of pressure. I mean, your entire body is right on top of them. And sometimes they can get a little leaky if you have been standing for a prolonged period of time, and you can get this eruption known as benign pigmented purpura. purpura. And there are a lot of different variants of this, but it is not dangerous. And I actually have a dedicated video just to this condition. So if you deal with something known as Schamberg's, you'll want to check that video out. But purpura can also be associated with more concerning underlying health problems like vasculitis, a more serious vasculitis, I should say. Also, certain medications, especially blood thinners. Vitamin C deficiency, aka scurvy, is notoriously accompanied by purpura because vitamin C is essential for healthy collagen. Without it, your blood vessels are going to be a leaky mess. Also, vitamin K deficiency. Vitamin K is vital for blood clotting, and therefore it makes sense that without adequate vitamin K, you're not clotting, you're bleeding easily into the skin. Underlying liver disease is another big culprit because clotting factors are made in your liver. Many autoimmune conditions also can present with purpura due to a variety of underlying reasons related to the autoimmune condition. Purpura, it is just a symptom. It's the underlying cause driving the purpura that really matters. Next, you have ecchymosis, or the classic bruise. Common causes for ecchymosis are, well, trauma. I got one the other day on my knee because I walked into the sharp corner of a table. Ouch. But if you have more fragile blood vessels, even little minor bumps that aren't necessarily of an intense pressure can elicit a bruise. Blood thinning medications also can make you vulnerable to bruising, and just age-related changes in the quality of collagen that makes up our blood vessels, and of course certain nutritional deficiencies. Here's when bruising needs to be taken seriously and evaluated in a much more critical fashion. If you have bruising that appears to come out of nowhere with no prior trauma history, bruising with bleeding gums and frequent nosebleeds, that right there, you need to see a doctor. If you're on a blood thinner, bruising is something you want to bring to the attention of your healthcare provider. Bruising that is accompanied by profound fatigue, perhaps night sweats, and unexpected weight loss, you definitely want to see your healthcare provider. If you have a ton of bruises in different stages of healing, like it seems like one pops up and then another one and then another one, and the first one starts to go away, but then you get another one, it's probably not you just bumping into stuff. These red flags can point to an underlying health problem, like certain blood disorders, liver disease, or systemic illnesses where there is an issue with blood clotting properly. Next up, I want to talk about something known as Livedo reticularis. This is a lace-like pattern of what appears to be bruising or purplish discoloration, almost like you have fishnet stockings on or lace. It can happen in cold weather, and as a matter of fact, you guessed it, I have a video on this condition, but it disappears once you warm up. And in those situations, it's completely normal. Where it becomes abnormal and concerning is if you have this lace-like pattern of purplish discoloration that persists. It doesn't come and go. And importantly, if it is accompanied by pain, or if it appears in warm temperatures, that's not normal either. These red flags of Livedo reticularis, they can be a warning sign of an underlying autoimmune condition, serious problems with proper blood flow, or inflammation around the blood vessels. So when does having these little purplish red spots, patches, bruises, when does this become something that is perhaps a medical emergency? Something that warrants urgent medical attention. Seek immediate medical care if you notice the sudden onset eruption of widespread petechiae. If you have bruising with fever or just feeling very unwell, purpura that spreads rapidly. If your skin bleeds easily from little pricks and nicks and that blood oozes, especially after starting a new medication. Bruising accompanied by fainting, dizziness, or shortness of breath. These signs can indicate serious issues with the blood, the immune system, or internal organs. What does a dermatologist have to do with any of this? How do they go about evaluating this problem? Well, if you see a dermatologist for unexplained bruising, typically they're going to review your medications and dietary supplements. Most people don't think of dietary supplements as causing problems, but oh, do they ever. Even things like fish oil or turmeric, yeah, can be a problem. They're going to likely ask you about a family history of certain underlying blood disorders and any new symptoms. And they'll likely order some blood work, including platelet counts and clotting tests. They'll likely want to check your liver function and for certain markers of autoimmune disease. And possibly they may need to perform a skin biopsy. A good skin biopsy can be an invaluable tool for evaluating for a potential vasculitis. And also, of course, a physical exam, evaluating for any underlying potential vascular problems or systemic causes. The goal is to find out whether the skin itself is the main problem or if it is merely merely a messenger for something going on internally. Now I want to give you some practical tips for healthier skin and vessels. I say it all the time, but you definitely want to be protecting your skin from the sun. Ultraviolet radiation, it damages the supportive collagen framework around the blood vessels. It leads to vessel fragility, and protecting your skin from the sun can help in warding off solar purpura down the line. Make sure you're eating enough vitamin C rich foods and leafy greens, and that you focus on variety in your diet so as to ensure optimal nutrition to support healthy skin and blood vessels. Avoid unnecessarily taking NSAIDs, non-steroidal anti-inflammatory drugs, unless your doctor has advised you, and discuss any steroid medications you may be on with your prescribing doctor. They do make you a lot more vulnerable to leaky blood vessels. For light discoloration, benign pigmented purpura, compression stockings can definitely be a game changer. They help direct the blood back up to the heart so that it doesn't collect in the blood vessels and then the blood vessels get all inflamed and leaky. And keep the skin moisturized. This helps support the barrier and lubricate the skin surface to reduce skin injury. Small habits add up. So to wrap it up, bruising and skin discoloration, they're not always simply cosmetic issues. Sometimes your skin is trying to give you clues that something is going on with your health internally. Pay attention to changes, trust your instincts, and don't hesitate to seek medical evaluation if something does not feel right. All right, guys, if you all found this video helpful, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.